is Guillain-Barre syndrome, commonly abbreviated as GBS. This is also known as post-infectious polyneuritis. The reason why it's called as post-infectious is because this disease is seen for the people who have been recovered from any kind of infections like GI infections or respiratory infections who had a recent infection. Only in those people this disease is being seen. So this is a autoimmune disease where our own immune system will attack the nerves and cause nerve damage. It is majorly attacking the peripheral nervous system. So whenever there is any damage to the peripheral nervous system, it can cause muscle weakness. If not treated early stages, it can lead to paralysis also. This is one of the rare condition and the cause is unknown. It is like there are certain triggering factors. As I mentioned, infection is one of the triggering factor. When there is an infection with a bacteria called Campylobacter jejuni or cytomegalovirus, Zika virus, these are the these are the bacteria which have been reported till now. So whenever there is an infection, it's like a triggering factor. It will trigger the immune system to produce antibodies which will attack the myelin sheath. So myelin sheath, as you all know, it helps in transmitting the signals. So once the myelin sheath is being damaged, that can cause weakness. So muscle weakness is one of the common symptoms seen in this disease. So the pathophysiology is like, as I mentioned, whenever an infectious agent enters our body, it will produce certain antibodies. So that antibodies is having same, like they will cross react with the glycolipids like GM1 and GD1B. These are present in the myelin sheath of our neurons. So when they are having the same, they will cross react and start damaging the myelin sheath and thereby causes nerve damage. So that is the pathophysiology. There are 4 types, that is AIDP, that is acute inflammatory demyelinating polyradiculoneuropathy, MFS, that is Miller-Fisher syndrome, AMN is acute motor axonal neuropathy, acute motor sensory axonal neuropathy. So these two, by the name itself, it says it's axon, where the axon is getting damaged, and these two is where the myelin sheath is getting damaged. The symptoms is like this will start with the tingling sensation or the weakness from the lower part of the body, and it will spread towards the upper part. So first symptom is seen in the lower part, that's the feet or the legs. Then for your upper part, that's the limbs and arms and all will get damaged, like weakness will be seen. Miller-Fisher, the symptom is it will start with the paralysis of your eye, also known as ophthalmoplegia. This is the thing, that's paralysis of the eye. This is the main symptom of Miller-Fisher syndrome. This is also seen in Asian people more. Compared to others, these are seen in the Western countries, but MFS is seen in the Asian countries. So the symptoms are like paresthesia, that is the tingling or pricking sensation of your feet that starts with the lower part of the body, then spreads to the upper part of your body. Then facial droop, like in stroke people, you see those one side of the face is getting like something like a stroke patient, facial droop. Diplopia, that is double vision, where the nerves of the eyes have been affected. Dysarthria is slurred speech. Dysphagia is difficulty in swallowing. What is this? Ophthalmoplegia is where the paralysis of the eyes, and pupillary disturbances. So this will be seen when there is any cranial nerve damage. When there is any autonomic nervous system damage, it will cause tachycardia, bradycardia, paroxysmal hypertension, that is irregular hypertension, whether it will be fluctuations will be there. Then when it affects the respiratory nerves, if anything is there, it will cause shortness of breath and dyspnea on exertion. These are the symptoms. The diagnosis is EMG, that is electromyography, that is nothing but, one second. So here the nerve activity of the muscles have been monitoring, because nerves have been affected in this. So electromyography is where the nerve activity of the muscles have been monitored, have been diagnosed, and NCS is nerve conduction studies. So in this, the velocity of the, like how long will it take for the conduction. So the velocity will be measured here. If there is any damage, the signaling will take long time. So prolongation of the conduction or conduction blockage will be measured in NCS. And lumbar puncture is by the spinal fluid will take and will check for the CSF, where the CSF protein level should not cross. If it is more than 400 mg per liter, it is considered as the patient is having GBS. The others are MRI or CT scan. This is done to exclude any mechanical causes for the myelopathy. That is, if any other causes can also cause show these symptoms, like these are congestion problem will be there. So in that condition, MRI and CT scan is also done. And complications are like it can cause DVT because there is weakness, the patient cannot move. So it will start DVT in their legs. So one of the complications is DVT, and pulmonary embolism or any respiratory complications can be seen. And neuropathic pains, as we all know that tingling sensation, there will be neuropathic pain. So these are the complications. The treatment is the treatment first therapy is flex therapy, that is plasma exchange. So in this you will be taking a small amount of blood from the patient, and you will separate the blood components with the plasma, and all the and only the blood components will be passed into the patient again, so they can produce new antibodies. So the auto antibodies which has been triggering for this GBS will be removed from the body. So that is flex therapy. It will be done for 10 days. Next is IV immunoglobulin will be given. That is because it will inhibit the auto antibodies or inhibit the antibody production. So that is the reason immunoglobulin given as 400 mg per kg per day for 5 days, or 1 gram per kg per day for 2 days. First they will start with flex therapy, and only then immunoglobulin will be given, like because flex therapy will be removing all the antibodies. So if they are giving IVG first, and if they give this, there is no use of the immunoglobulin. So first flex therapy, and if that doesn't work, if that is not able to get rid of all the antibodies in the patient, they'll start with immunoglobulin. And next is anticoagulant as the complications. DVT is one of the complications, so anticoagulants like heparin or enoxaparin will be given. So here enoxaparin 60 mg was given once daily for the patient. Analgesic for the pain, like gabapentin will be given for neuropathic pain, and carbamazepine or any tricyclic antidepressants like nortriptyline and amitriptyline have been proven to decrease the neuropathic pain. So analgesics will also be given. That's it. Thank you.